Hi guys, welcome back to my channel. If this is your first time of visiting this channel, please note that I'm doing a series of videos to offer guidance for the RCGP AKT exam, and in this video I'll be talking about RCGP updates and feedback for the AKT exam, which will be useful for those hoping to take the exam in this year 2023. If you've not watched part 1 of this video, I'd advise you watch that first and then continue from here. Please like, share, and subscribe if you haven't. Feel free to drop in a comment. And if you're a GP registrar who has taken this exam, please drop a comment and share some advice as well. This video is part 2 of the RCGP feedback and guidance for the AKT exam in 2023. So if you've not watched part 1, please do so and continue from here. So the RCGP has stated emphatically that they will continue to test on any MHRA guidance. So for those not familiar with MHRA, it's Medicines and Healthcare Products Regulatory Agency. So they have stated they will check on knowledge regarding guidance on this relevant to general practice, not only around sexual health, but also other areas of clinical practice. Important to take note of that. And based on the past 12 months performance, that's based on a year's performance, the RCGP has highlighted a need for improvement regarding 1. Improving quality, safety and prescribing, and this has to do with drug monitoring, side effects of drugs used in long-term conditions, and antimicrobial stewardship. 2. Leadership and management, so issues surrounding confidentiality, access to medical records. 3. Gastroenterology, so this relates to long-term condition management and diagnosis of GI symptoms. 4. Respiratory health, this relates to asthma management and simple calculation using respiratory parameters. And 5. Sexual health, concerning the choice of contraception with teratogenic drugs, diagnosis of pregnancy, and erectile dysfunction diagnosis. I believe it will be important for registrars preparing to pay close attention to these areas, because who knows, questions from these areas may show up in the upcoming exams this year. The RCGP states that they hope that candidates will not overlook these and other important areas in the exam preparation. A word to the wise is enough. Let's not forget to be careful and ensure that we do not engage in any malpractice or misconduct. And they have stated that if you've got any comments or questions, you should email exams@rcgp.org.uk. So in the next section, we're going to dissect the general advice and feedback points. So they express that they have noted that some candidates are less familiar or experienced than others, possibly due to some of us being IMGs as compared to the local graduates. So they encourage candidates who are in this position, for example, around women's health issues, data interpretation and application of basic medical statistics, evidence-based practice, general practice organization and management, or any other topic, to identify these early in their training as learning needs. So if you know that you're not familiar with statistics and the admin side of the curriculum, it's important to pay close attention to that. There are free videos on YouTube, free resources. There are also paid courses you can book to attend. and increase your knowledge in these areas. They also remind candidates that the AKT tests for appropriate and cost-effective management. So sometimes the correct answer is not to investigate. Guys, this is a clue. Some answers to some questions may be not to investigate. They have noted that candidates find this option a difficult one to choose. This means that most candidates get these questions wrong. Some questions may relate to clinical situations such as the management of mildly abnormal blood test results, for which additional testing is not required, and this may be the correct answer option. Should be mindful of that then. Next, they have stated that multiple screening blood tests are sometimes requested in a non-discriminatory way without considering specific likely possibilities. So in the AKT, some questions will ask candidates to choose only one test from a list of answer options, including other tests, to confirm the most likely diagnosis from the given scenario. They say that they will make these question stems clear as to what is being asked for. So there may be questions asking for the single most appropriate diagnostic test. So it's important to make a note of what exactly the question is asking, so you won't be swayed in choosing the wrong answer. The RCGP will ask about abnormal examination findings, including significant retinal examination findings. Ophthalmology here again, remember we saw management of common eyelid conditions and self-management advice, and here they have highlighted retinal examination findings, which will generally be in the form of photographs. This is worth noting and familiarizing yourselves with these photographs and appearances of retinal condition. They state that photographs of skin problems will be from a range of different ethnic backgrounds, so we need to familiarize ourselves with how skin conditions present on individuals from different or from the various ethnic backgrounds. They may ask about investigations commonly undertaken in secondary care after patients are referred. This is because they expect registrars to have sufficient awareness to be able to respond to patients' questions about possible further tests when a referral is discussed. So that is worth noting. So it's not only about investigations in primary care, but some in secondary care as well. For example, for investigation of suspected cancers. And note that they don't expect us to have detailed knowledge of that. The RCGP reminds candidates that drug choices should be those that reflect evidence-based, widespread, and accepted practice in primary care, and not those that a secondary care doctor with specialist skills and experience might sometimes make. Now, calculations. I believe some people may not really like maths, or some may like it like I do. It's very important to ensure that any decimal points are in the correct place. I believe this applies to free text answers, just so that you don't miss precious marks by wrongly placing decimal points. They have advised to reality check answers, especially about volume to be administered type of questions. That's important. So they have stated that the approach to testing around immunizations has moved away from expecting detailed knowledge of the immunization schedules. Oh, that's good to hear, meaning that we don't necessarily have to cram the immunization schedule, which I find very difficult to do, honestly. However, the RCGP expects candidates to be aware of important indications, contraindications, and side effects of childhood and other common immunizations. They also expect some knowledge of occupational vaccine requirements as they apply to GP settings. So, occupational vaccines and indications, contraindications, and side effects of childhood vaccines. Overall, most candidates do well in questions on data interpretation and general practice admin. They use a range of resources to test this, including the types of graphs and tables regularly sent to practices from local health service organizations and health boards. So, if you are not familiar with statistics or with the various graphs, it would be worth paying close attention to that. The GP curriculum gives further advice or guidance about professional and admin topics, and GP trainers can provide useful help to candidates. I believe it will be helpful to discuss these topics, the admin topics, with clinical or educational supervisors as well, since they have great wealth of information, probably our practice managers as well. So, registrars could explore that. Safeguarding issues will be tested in the AKT exam. Remember, we've all done learnings on adult and child safeguarding, and they have stated that they will continue to test this in the exam. The RCGP will continue to test on new and emerging knowledge relevant to primary care, and that includes areas such as COVID-19. Therefore, it's important to still keep ourselves updated on COVID and other new and emerging knowledge relevant to primary care. Last but not least, the RCGP points out that almost all candidates answer every question in the AKT. That's great because there is no negative marking in the exam. Marks are not deducted if the chosen answer option is wrong. So, guys, answer all questions. There's no negative marking. I know some of us have experienced negative marking throughout our medical training, especially those of us IMGs. And the good news is in this exam, there is no negative marking. So go all out and answer all questions. This brings me to the end of the video. Please like, share, and subscribe. Drop your comments. Let me know what you think about this. Wish you all the best. Take care. Bye for now.